Medical news, a potentially fatal disease unknown just months ago is spreading so quickly that doctors now say it's a national epidemic. Tonight, George Strait has a Medical Watch report on this mysterious disease and what's being done to fight it.
For the last year, Phil Lanzarotta has been
part of a US TV newscast from 1982, and now in the 30th year of the first cases diagnosed in the USA, and HIV/AIDS is still an epidemic, and still there's no cure. As a result, over 30 million people globally have died from HIV/AIDS, and another 30 million around the world are living with the virus. And according to health agencies, if nothing is done to halt the march of this deadly virus, 30 million more people worldwide will become infected in the years ahead. Manuel Andriote is a Connecticut journalist, author and activist from Norwich, whose 1999 book Victory Deferred, How AIDS Changed Gay Life in America, has been updated and republished for this 30th anniversary year. I spoke to him recently about the new book and asked why he'd written the original in the first place.
Because after reporting on the HIV epidemic since the late 80s, while I was in journalism school at Northwestern University, I had developed contacts throughout the country, people in AIDS organizations, people in government agencies, people in the gay community, and I thought, well, I was in a good position to write a book about how AIDS Changed Gay Life in America, which is the subtitle of the book, and to look at the responses of gay communities around the United States and in Washington at the national level.
But John isn't the first to write such a book. San Francisco Chronicle reporter Randy Shilts, himself a gay man, wrote and the band played on back in 1987. Randy chronicled the early years of HIV/AIDS in the USA and particularly on the West Coast, the political infighting as well as the bitterness in the gay community. Sadly and ironically, Shilts' fortunes were to run out in 1994 when he died from complications from HIV/AIDS. It was in that same year Andriote decided to take up the cause that Shilts had started, to rechronicle the rise of HIV/AIDS in America and how it had progressed, talking to anyone and everyone.
So I interviewed people from the community level on up to people at the highest levels of the federal government. Dr. Anthony Fauci, who is the federal government's highest-ranking AIDS scientist, the director of the National Institute of Allergy and Infectious Diseases. People were very willing to talk to me, either because I knew them already, having interviewed them, or I was referred to them by people they knew, but they were also interested in getting their stories out there and the sort of acknowledgement of what they had been part of in recognizing both their suffering and their amazing accomplishments in responding to AIDS.
When Andriote's book finally came out in 1999, it was an instant hit, winning him praise and a 2000 Lambda Literary Awards Editor's Choice Award, and was also named an honoured book by the American Library Association. And more recently, his collection of interviews, which run into the hundreds, which he used to write the original and the updated version of his book, are now housed in the Smithsonian in Washington, D.C., as a reference for future generations.
My book continued to tell the stories that Randy had first introduced to the world. And I really felt in a real way, especially since Randy himself had died from AIDS, that as a journalist, it was important to me to feel as though I was sort of carrying Randy's mantle, as it were, and really continuing his important work in recording and chronicling this history. The review I was proudest of Victory Deferred was from Kirkus Reviews, which called Victory Deferred the most important AIDS chronicle since Randy Shilts's And the Band Played On. And to have my book mentioned in the same breath as Randy's book was an amazing accolade, and I was very proud of that.
The newly revised book is part of a personal journey for Andriote as he looks back over the last 30 years of the virus, and also because his own life was thrown upside down several years ago when an annual health check turned out to be anything but normal.
My own HIV diagnosis in 2005 really gave me a very different perspective on these issues. One of the most startling things for me since my own diagnosis was to realize something that HIV-positive people had said to me in my interviewing them over the years, which was that, the view from that side of the viral divide, as people have seen it, is a very different view. And now that I've been on both sides, I can truly say that the view from this side of HIV really is very different. Now I see other people, other gay men, who at the end of the day, HIV is not their personal story. And they are able to enjoy the luxury that I can no longer enjoy of walking away from it, as they care to.
Andriote is also an activist and is outspoken about gay and human rights organisations here in the US in his book, talking about their apparent lack of interest in supporting and educating people about the HIV epidemic, pushing it to more specialist organisations, whilst they favour the fight over gay marriage rights and the now defunct Don't Ask, Don't Tell policy. Things he says are important for gay people going forward, but not as important as the continued threat of HIV/AIDS.
Advocating on behalf of the health and the very lives of gay and bisexual men of all races in the United States is far more important than advocating for marriage equality, which is not an issue relevant to all gay people. But I think it's fair to say that all gay people are interested in their health and well-being. What's important to point out is that the people who financially support the Human Rights Campaign and the National Gay and Lesbian Task Force tend to be middle-class white gay and lesbian people who have the disposable income that allows them to support those organizations. And those are the people who, at this point, tend to be privately insured, tend to be able to access the expensive antiretroviral therapy that it takes to live well with HIV. But meanwhile, it's the people of color, the African American and Latino men who don't have money and who don't have privilege and who are not financial supporters of these gay political organizations. Those are the people who are most at risk and most affected by HIV in the United States. And it seems to me that they really have been thrown under the bus by these political organizations that are really catering to a pretty bourgeois agenda.
And what of the future and the years ahead? Despite recent promises by President Obama to increase help to 6 million people around the world living with HIV/AIDS in his World AIDS Day speech on the 1st of December this year, as Andriote puts it, there's so much more to do and we all have a role to play.
I think that educating people about HIV really is a responsibility of everyone, from parents to schools, to the communities that are most heavily affected by HIV, particularly the gay community, the African American community, that it really is our responsibility to educate young people about how to protect themselves and their partners so that they don't have to face a lifetime of potential illness, of expensive medical care, so that they will understand that it's possible to be healthy sexual beings, to enjoy a healthy sex and romantic life without putting themselves at risk.
For details about John Manuel Andriote and where to find his book, visit his website at www.victorydeferred.com. For CT News Junkie, I'm Brian Scott Smith.